Are stillbirths rampant among fully vaccinated mothers? No, that's not true. The claim that there is a spike in stillbirths among mothers who had received a full COVID-19 vaccine is not supported by any evidence. It was made by a doctor in Canada and was denied by 2 Canadian healthcare organizations, and is the opposite of statistics published by the U.S. Centers for Disease Control and Prevention. The claim was made by a doctor whose false COVID-19 claims have been previously debunked by lead stories. The claim appeared as an article published by Gateway Pundit on December 11, 2021, titled, "Video, Doctor Warns Stillbirths Are Rampant Among Fully Vaccinated Mothers, Launches Investigation," which opened, quote, "The Center for Disease Control and the federal government is adamant that pregnant women get a COVID-19 injection. But data doesn't support its safety and health practitioners around the world are sounding the alarm." A Canadian doctor, who has effectively treated COVID patients with ivermectin throughout, urges pregnant women to abstain from getting the COVID. End quote. Users on social media only saw this title, description and thumbnail. Quote, "Video. Doctor warns stillbirths are rampant among fully vaccinated mothers, launches investigation. The Center for Disease Control and the federal government is adamant that pregnant women get a COVID-19 injection. But data doesn't support its safety and health practitioners around the world are sounding the alarm." A Canadian doctor, who has effectively treated COVID patients with ivermectin throughout, urges pregnant women to abstain from getting the COVID. End quote. The article continued, quote, "Speaking to a reporter in November, Dr. Daniel Nagase argues COVID vaccines are directly attributed to an alarming increase in stillbirths across Canada. Doulas who work in women and children's hospitals in one of the birthing centers for Vancouver had 13 stillbirths in a 24-hour period," Nagase contends. "In Waterloo, Ontario, I have a more reliable statistic," he continued. "There were 86 stillbirths between January and July. Normally, it's only 5 or 6 stillbirths every year. So, about 1 stillbirth every 2 months is the usual rate. To suddenly get to 86 stillbirths in 6 months, that's highly unusual," he continued. "But the most important confirmation that we have from the Waterloo, Ontario report was that all of the 86 stillbirths were fully vaccinated." End quote. Nagase claims he has successfully treated patients with COVID-19 with ivermectin, an anti-parasitic drug that is not recommended by the Centers for Disease Control and Prevention, CDC, nor by manufacturer Merck for treatment against the virus. The Canadian Broadcast Corporation debunked his claims regarding stillbirths in women who received a full COVID-19 vaccine, and noted the hospital where he previously worked said he was under review for his extremely disappointing conduct and was not scheduled for upcoming shifts at the hospital. Lead Stories has debunked the claim by Nagase that messenger RNA, mRNA, COVID-19 vaccines instruct cells to produce non-human proteins, spike proteins, that would stunt the development of children's immune systems. On the contrary, the purpose of spike proteins produced by mRNA COVID vaccines is to assist in triggering the body's immune system and help the body recognize the SARS-CoV-2 virus and attack it. Vancouver Coastal Health, the regional health authority, published a series of tweets on its official account at VCH Healthcare denying the claims made by Nagase, calling them rumors and disinformation. The health agency's tweets were posted on November 23, 2021, 18 days before the Gateway Pundit published its story. Quote, "Vancouver Coastal Health, VCH, is aware of rumors and disinformation spreading on social media regarding stillbirths at Lionsgate Hospital, LGH, as a result of mothers having been vaccinated against COVID-19. Thread. Vancouver Coastal Health, at VCH Healthcare, November 24, 2021." End quote. Grand River Hospital in Waterloo also posted a debunk on its official Twitter account at GR Hospital KW on November 26, 2021, writing that stillbirth rates remain steady at 0.2 and 0.4%, and are lower than the national average. The message read, quote, "Thread We are aware that misinformation has been circulating on social media reporting an increase in stillbirths in the Waterloo region in the last year. Spreading misinformation is dangerous and unfortunate, and creates unnecessary anxiety and fear among expectant families. 1/2pic.twitter.com/Gxiavalovi, Grand River Hospital. At GR Hospital KW, November 26, 2021. End quote. The CDC published a report on November 26, 2021 titled, Risk for Stillbirth Among Women with and Without COVID-19 at Delivery Hospitalization, United States, March 2020 to September 2021.